What if I told you that the very foods you've always believed were good for your heart could silently increase your risk of a stroke while you sleep? No pain, no warning. You're just sitting in your chair, reading a book or watching a show. Then the next morning, you wake up unable to move your arm, or worse, you can't speak. It feels like it came out of nowhere. But what if I also told you that it didn't? As a brain doctor, I've seen this pattern far too often, especially in adults over 60 who were doing everything right. They exercised. They stayed away from sugar. They took their medications. They even ate clean. Lots of greens, juices, fresh veggies, and still stroke. So what's going wrong? The truth is, after 60, your body doesn't respond to food the same way it did when you were 30. Your kidneys don't filter as well. Your blood vessels aren't as elastic. Your hydration levels drop faster overnight. And most importantly, some foods that were once helpful can quietly become harmful when combined with medications or eaten at the wrong time. Take vegetables. We all grew up believing the more, the better. But instead of more, what if it should have been smarter? Because it turns out certain vegetables, yes, the ones sitting in your fridge right now, contain natural compounds that may interfere with blood pressure, circulation, or blood clotting, especially when you're sleeping and your body is at its most vulnerable. And that's what this video is about. You don't need to be afraid of vegetables, but you do need to understand which ones need extra care and how to enjoy them safely without putting your brain at risk. After all, protecting your memory, your independence, and your ability to speak or move freely might come down to what you had for dinner. Let's begin. Now, before we dive into the list, I want to make something clear. This isn't about fear, it's about awareness. And it's especially important if you're over 60 or love someone who is. See, when we talk about vegetables, we often say, just eat more. But the real key, it's not what you eat, it's when and how you eat it. Because after 60, your digestion slows, your blood pressure can shift more easily. And small choices, like having a raw spinach smoothie before bed or drinking beet juice on an empty stomach, might quietly tip the balance in the wrong direction. These changes don't happen overnight, but the consequences often do. So in the next few minutes, I'll walk you through 7 vegetables that are healthy in theory, but may raise your stroke risk if eaten the wrong way, at the wrong time, or in the wrong combination. Don't worry, I won't tell you to throw everything out. In fact, you can still enjoy each one of these with just a few smart tweaks. Ready? Let's start with the one leafy green most people trust the most, spinach. Let's begin with a vegetable that most people believe is the gold standard of health, spinach. It's packed with iron, folate, vitamin K, nutrients we're told support everything from strong bones to better memory. And for decades, it's been a favorite in smoothies, salads, and dinner plates across America, especially for folks trying to eat clean or manage their weight. But here's what few people over 60 are ever told. Spinach is also very high in oxalates. Oxalates are natural compounds found in many leafy greens. In small amounts, they're harmless. But in larger quantities, especially when eaten raw and daily, they can bind with calcium in your blood and form tiny crystals. These crystals don't just affect your kidneys. They can also harden blood vessels and increase the risk of clot formation. And here's where it gets tricky. Most older adults are slightly dehydrated by nightfall. Many take calcium or vitamin D supplements. Some are on blood thinners like warfarin or aspirin. And when you mix those factors with a big raw spinach salad at dinner or a smoothie before bed, you might quietly be setting the stage for clot formation without even realizing it. In fact, a recent long-term study showed that people who consistently consumed over 220 mg of oxalates per day without enough calcium had up to 2.4 times higher risk of cardiovascular disease. That's not a guess. That's data. So does that mean you should stop eating spinach? Not at all, but how you prepare it matters. Instead of raw spinach every day, try steaming or sautéing it. Cooking dramatically lowers oxalate levels and makes it safer, especially for aging kidneys and blood vessels. And here's a powerful tip. Pair spinach with a small amount of calcium, like cheese, yogurt, or milk. Studies show this helps bind oxalates in the gut and prevent them from circulating in your blood. Remember, after 60, it's not about eating less healthily. It's about eating smarter. And sometimes that means changing how we treat even the foods we trust most. Next up is a vegetable that many people turn to for heart health, especially those trying to manage high blood pressure. Beets. Whether it's roasted beets on your salad or a quick glass of beet juice in the morning, this vibrant root vegetable has earned a reputation as a natural vasodilator, something that opens up blood vessels and improves circulation. And it's true. Beets are rich in nitrates, which the body converts into nitric oxide. This molecule helps relax and widen blood vessels, which can lower blood pressure. Sounds great, right? But here's the catch, especially if you're over 60. As we age, our blood pressure doesn't regulate as quickly, and medications like ACE inhibitors, beta blockers, or diuretics make our systems more sensitive to shifts. That means when you add beet juice, or even just a large serving of beets on top of your regular meds, you may push your blood pressure too low, especially overnight. And low blood pressure while you sleep, that's no small thing. It can reduce blood flow to the brain, leading to dizziness upon waking, blurry vision, or in more serious cases, a mini stroke or even full-blown stroke without warning. A recent 2025 study from the University of Exeter found that adults over 60 who drank 2 beetroot juice shots daily lowered their blood pressure noticeably within just 2 weeks. But the effect came from how the nitrates interacted with oral bacteria, meaning the results were fast, but not necessarily long-lasting. Other studies showed that using beet juice daily beyond a few weeks might not keep working, and could even lead to unpredictable swings in blood pressure. So what should you do? Moderation and timing are everything. Instead of drinking pure beet juice daily, consider cooked beets 2 or 3 times a week, preferably with meals. Avoid beet juice at night, especially if you're already on blood pressure meds. And don't forget, while nitric oxide from beets can help open your blood vessels, too much too fast can close the door to safety. Beets are powerful, but after 60, power should always be used with care. Now let's talk about something you probably use every day without a second thought. Garlic. It's more than just flavor. It's one of nature's oldest remedies. For centuries, garlic has been praised for its ability to lower cholesterol, fight infections, support circulation, and even strengthen the immune system. Many people over 60 have added more garlic to their diets, hoping to boost heart health naturally. And here's the truth. It does have benefits, but if you're taking medications like aspirin, Plavix, warfarin, or other blood thinners, garlic might be doing more than you bargained for. That's because garlic, especially in its raw form, acts as a natural anticoagulant. In other words, it makes your blood thinner, just like those prescriptions do. And while a little thinning can help reduce clot risk, too much thinning quietly increases the chance of internal bleeding. Now here's the danger. There's usually no warning. You don't feel woozy. You don't feel pain. But one small fall, one bump to the head, or even a strong cough could trigger a bleed, sometimes inside the brain. I've known patients who ended up in the ER, confused and disoriented, only to discover they'd been bleeding internally without knowing it. And often, raw garlic was part of their daily health ritual. So how can you keep garlic in your life without increasing your stroke risk? First, go easy on the raw garlic, especially if you're taking any blood-thinning medications. Instead, use cooked garlic. A quick sauté or slow roast softens its blood-thinning effects, while still offering most of its benefits. And be sure to tell your doctor if you eat garlic daily. Many don't think to mention it, but it can absolutely influence how your medication behaves. Here's the bottom line. Garlic isn't the enemy, but when nature's medicine mixes with prescription drugs, you need to stay informed. Because after 60, even healthy choices should be made with wisdom, not just habit. Eggplant might be one of the last vegetables you'd expect to pose any risk. It's soft, mild, comforting, a favorite in stews, casseroles, grilled dishes, and often seen as a low-calorie, heart-friendly food. But under that silky skin lies a compound that deserves your attention, especially if you're over 60. It's called solanine. Solanine is a natural chemical found in nightshade vegetables, like potatoes, tomatoes, and of course, eggplant. In small amounts, it's not harmful. But when consumed in excess, especially by people with already compromised circulation or neurological conditions, solanine may trigger something called vasoconstriction. That's when your blood vessels tighten, reducing blood flow, particularly to the brain. And here's what that can feel like. You might eat a heavy eggplant dish and notice feeling slightly foggy afterward, or you may feel lightheaded but not know why. Over time, if you eat eggplant frequently and your blood vessels are already narrowed, this constriction could contribute to microclots or even a transient ischemic attack, a mini stroke that comes and goes quietly. So what can you do? Start by avoiding raw eggplant. Though most people don't eat it raw, it's worth stating clearly. Always cook eggplant thoroughly, whether it's baked, grilled, or sautéed. Cooking helps reduce solanine levels and makes it much easier on your system. And if you've noticed feeling off after eating eggplant-heavy meals, take it as a signal. Your body may be telling you to slow down. Eggplant doesn't need to be eliminated from your diet, but for older adults, moderation is key. Aim for no more than 1 or 2 servings per week, and consider rotating in softer, antioxidant-rich vegetables, like carrots or squash, that support your brain and circulation without the vasoconstrictive downside. Because sometimes the gentlest-looking foods carry the quietest risks. Soybean sprouts might seem like the safest thing on your plate. They're light, crunchy, packed with protein and fiber, and they're a staple in many clean-eating plans, especially in soups, salads, or stir-fries. But if you're a woman over 60 or someone managing hormone-related conditions, there's something you should know. Soybean sprouts are high in phytoestrogens, plant-based compounds that mimic estrogen in the body. For younger people, that might not make a huge difference. But once you reach menopause, when your natural estrogen levels drop, your body becomes much more sensitive to anything that can shift that balance. And phytoestrogens don't just affect hormone levels. They may also influence your blood's ability to clot. If you're on hormone replacement therapy, or if you've had a history of clotting disorders, combining soy sprouts with medications, or even certain genetic predispositions, might tip the scale toward an increased stroke risk. It doesn't happen to everyone, and it's not immediate, but it's silent. And like most of the risk we've discussed, there's often no early warning. Some men may also be affected. Long-term consumption of high phytoestrogen foods has been linked to changes in metabolism, and in rare cases, hormone-sensitive issues. It's still debated, but worth noting if you eat soy products daily. So what's the smarter choice? Cook your sprouts. Light sautéing or blanching them reduces the phytoestrogen activity. Don't treat soybean sprouts as a daily staple. Treat them more like a supplement. A handful once or twice a week is likely fine. Just don't build your entire diet around them. And if you're already on medications that affect hormones or blood clotting, be sure to mention soy intake to your doctor. It may sound like a small detail, but after 60, small details make a big difference. What feels light and healthy can quietly carry weight. Let's move to something that brings both flavor and nostalgia to the table. Pickled vegetables. Whether it's sauerkraut from your childhood, homemade cucumber pickles, or store-bought kimchi, these tangy, crunchy foods feel like a harmless side dish. And in moderation, some even offer probiotic benefits. But if you're over 60 and watching your blood pressure, pickled vegetables might be doing more harm than good, especially at night. Why? It all comes down to one ingredient: salt. Most pickled vegetables are packed in brine, a solution high in sodium, and sodium has a direct effect on your blood pressure. It causes your body to retain water, which increases blood volume and pushes pressure against your artery walls. That's tough on anyone, but it's especially risky for older adults whose blood vessels are less elastic and whose kidneys don't flush sodium as efficiently. Now, here's the part most people don't realize. Eating pickled veggies close to bedtime, when your body is winding down, can cause your blood pressure to rise overnight and stay elevated. This pattern, known as non-dipping hypertension, is one of the strongest predictors of stroke in older adults. And the worst part? You won't feel a thing. You may go to bed feeling perfectly fine and wake up with slurred speech, facial drooping, or worse. So should you give up pickled foods completely? Not necessarily. Here's a smarter approach. Make your own low-sodium pickles at home. Use less salt, more vinegar, and try flavoring with garlic, dill, or herbs. Avoid eating pickled foods late in the evening, and always check sodium labels on store-bought jars. Some have over 1,000 milliliters per serving. A little crunch and tang is fine, but after 60, it's time to trade tradition for balance. Because brain health doesn't just come from what's in your head, it starts with what's on your plate. Now let's talk about one of America's favorite vegetables. Even though technically it's a fruit, tomatoes. Juicy, vibrant, packed with lycopene. Tomatoes are often praised for supporting heart health, reducing inflammation, and even lowering cancer risk. Whether it's sliced fresh on a sandwich, stirred into pasta sauce, or juiced as a morning pick-me-up, tomatoes feel like the perfect healthy choice. But for adults over 60, especially those with borderline kidney function, there's a quiet risk many overlook. Tomatoes are high in potassium, and while potassium is essential for nerve and muscle function, including the heartbeat, too much of it can be dangerous when your kidneys aren't working at full strength. As we age, our kidneys naturally slow down. If you have high blood pressure, diabetes, or have ever been warned about kidney numbers during a checkup, your ability to filter out potassium may already be reduced. When potassium builds up in the blood, it's called hyperkalemia, and it often shows no symptoms until it's too late. It can cause irregular heartbeats, muscle weakness, and in severe cases, sudden cardiac arrest or stroke-like symptoms. Here's where it gets tricky. Most people don't think of tomatoes as a potassium source, but 1 cup of tomato juice can have 500 nanograms or more. And tomato sauces or pastes are even more concentrated. So how do you stay safe? Cook your tomatoes. Heating them actually reduces potassium concentration per bite and helps your body absorb lycopene better. Be mindful of portion sizes. Avoid drinking tomato juice daily unless your doctor approves. And if you've ever been told your potassium is a little high, it may be time to ask about how tomatoes fit into your diet. Because when your kidneys slow down, your choices need to catch up. Tomatoes can still support your health, but only when they're part of a plan that supports your whole system. So, where does all of this leave us? It's not about fearing vegetables. It's not about throwing away everything in your fridge. It's about realizing that after 60, your body changes, and what once helped you thrive may now need a little adjustment to keep you safe. You've just learned how 7 seemingly healthy vegetables, spinach, beets, garlic, eggplant, soybean sprouts, pickled veggies, and tomatoes can quietly affect your brain and blood flow, especially when eaten in the wrong form, amount, or at the wrong time of day. But that knowledge isn't meant to overwhelm you. It's meant to empower you. Because your memory, your independence, your ability to enjoy a walk, laugh with your grandkids, or read a book in peace, they all depend on protecting your brain. And protecting your brain doesn't mean avoiding vegetables. It means being thoughtful with them. A little steam here, a smaller portion there, swapping out that bedtime salad for a warm, gentle soup. These are small changes, but they create real safety. Your body isn't failing, it's just evolving. And with the right knowledge, you can evolve with it, staying sharp, strong, and in control of your health. This isn't about eating less, it's about eating smart. So the next time you reach for a vegetable you thought you knew, just pause, think, and make the choice that's right for where your body is today. If this video helped you think differently about your health, I'd love for you to take a moment and share your thoughts. Have you made any changes to your diet after 60? Did one of these vegetables surprise you? Let us know in the comments. Your story might help someone else feel less alone and more confident in their choices. And if you'd like more clear, trustworthy tips on brain and heart health for older adults, stay connected. There's always more to learn, and we're here to learn together because your health deserves clarity, not confusion. And sometimes a small change today can make all the difference tomorrow.